This will be the IMT curriculum for upper extremity. At this point you've probably taken the lower extremity course, so some of the information will be easy for you to understand. The difference in this curriculum will be that we're going to try to put it into a protocol that you can use. Feedback has been that we want a protocol that we could actually go through. Whereas the first course gave you more ammunition, as I call it, a lot of ways to do a particular technique to achieve a certain result. This is going to focus more on a protocol that you can actually start and incorporate through a session. We'll have 4 sessions here, or 4 sections, and the first one we're going to do is spinal balance. Before I get going, let me make this point. There's nothing new under the sun. There's a lot of ways to do the same thing. The information that I show you comes from so many different sources. If I forget to tell you who it came from, don't take it personally, because you can't remember all the people that you pick up things from. The good thing is that you do pick it up and that you do make it work better. And just as I show you this information, I'd like you to take it then and add what works for you, and hopefully you'll get good result out of it. We're going to start out then with this spinal balance. The first thing we want to do is pick up something from the concept of Ida Rolf, and that is to improve the breathing. Really get that thoracic cage moving, increase the metabolism. That's a very important thing to do. And some of these breathing techniques come from different people, like Michael Shea, Sean Reed. Just several different people have different ways of doing it, and we've incorporated as much as we could along with what we like to do. And so our model today is Wayne Eisworth, and I think you've seen him in a previous video, so we've got him in here again. We call him our guinea. It's politically incorrect to say pig nowadays, don't forget that. Okay, Wayne, I'd like you to take a nice deep breath and blow. And as he does so, I press down. I'm right above the clavicles with the heel of my hand, pressing down through the sternum, and breathe. And I'm resisting the breath and blow. And I just kind of shake it out as it goes all the way down. Then you'll breathe in hard, and I'll let go suddenly, and you'll feel that snort that occurs. And that's shocking the pleura of the lung, trying to get that diaphragmatic movement really to clear up. Next thing we want to do then is get over to the costal edge, and we'll place our hands at the costal edge and up here on top of the sternum again, and holding the clavicle and pressing inward as he breathes out. And again, keep shaking it and breathe in, and resist it and breathe out, and breathe in and release. Now I'll do this normally on both sides, but to save time on this video, I'm only going to do basically one side. We won't leave him lopsided. At the end of the session I'll go through and balance everything out, but I'm just not going to do both sides for the time expediency of it. Okay, so next thing we want to do is a little bit of extremity work, and again, Ida Rolf says work these extremities before you do the core work. Get all the extremities so you get all that proprioceptive signaling that's going on. And this, if you don't recognize it, when the arm is flat and across like this, is stretching the infraspinatus muscle. And Wayne, at this point, and always hold above the wrist, make sure you have a nice solid hold. Take a deep breath, hold it, and pull back just on your shoulder. And as he pulls back on the shoulder, kind of rock in through the resistance, and he's holding his breath, and blow. And open up the arm, and again you're opening up that thoracic cage when you're doing that. So this is the assisted breathing. Okay, and we're going to continue doing this now. This was with the arms, and now we're going to go down to the legs. One of my favorite techniques here is this loosening up technique, and it comes from chiropractic. I place my finger down under the Achilles tendon, and I place the foot directly into my abdominal, holding the top of the arch and pressing, and it's a very good stretch for the Achilles tendon. Turning the foot sideways, we're working one part of the gastroc, and again, turning again the other side of the gastroc. But what you want to feel is this shaking movement going all the way down, and watch the head, watch the chin move, and you'll know you're getting a good movement through the entire body. And so the spine's getting a little bit of adjustment here. Of course, we don't do adjustments. We're massage therapists, so we're moving the soft tissues and taking the tension out of them. Okay, at that point then, I'll bend his leg, ask him to take a nice deep breath and push toward me just a little bit with a little bit of resistance, and release and blow. And that's going to allow him to go way down. And again, take a deep breath and push against me, and release and blow. And this is how I keep my viscera in good shape. I stick people's feet in my guts all day. So that's a really nice thing to work for me. Now I'm looking at the curriculum. I have it posted up here so I don't miss it. I'd like to stay with it in the same way that you can stay with it whenever you're doing it, so you can read along. This is a T6 spinal fulcrum. It's called a vital diaphragm bladder 38 in acupressure. The key to it is to take your hands, reach around at the base of the scapula with your fingers, and then go medially in toward the spine. And as you're doing so, you hold this position, and it's a very relaxing thing that occurs to the body because it has what's called a potentiate point back here, the bladder 36, and it just relaxes the body. So if a person's really stressed out, this is a very good way of getting a nice relaxation. You can also go down from here down to around L1, and slightly off of L1 they have what's called a synchronizer, and this particular synchronizer again helps to relax some of the body. Sharon Weiselfish works with synchronizers, and she has a curriculum that is advanced positional release. So we reach in here, I just slide in, grab the tip of the scapula is right about under my index fingers, and I simply press in. Now this could be considered an induration technique also. If you look at induration techniques from the previous course and how it's done, you simply press in on the spine and that relieves the tension. And we do that for a moment. Often you'll wait and you'll hear a nice breath. The person goes into a nice relaxed state. Some of this comes from Fritz Smith's work. He developed zero balancing. Fritz was one of the osteopaths who says his dad was one of the first chiropractors. And he developed a curriculum that he called zero balancing. So I've taken components from that I found to be useful. And basically it's moving the osseous structure by adding these fulcrums. And I bring the leg up, brace it over my knee as you can see. Now I add this to it, and that is this hold. This comes from martial arts. It's a way of locking in a limb. So I add traction toward me, and as I bring the traction toward me, I'll rotate and bring my leg up underneath it so I can get a little raise. We'll place my hand in directly starting at the sacrum and just press in along the SI joint and press into all the bony areas of the hip. And what this is doing is relaxing the tendinous attachments to the hip. So normally I press in, start at the SI, follow the crest and just kind of press the bone, go down in around the trochanter, and then when I get down to the ischial tuberosity, I usually take my hand and I flip it like this, and I throw it on top of my thumb. That allows me to then just work around that ischial tuberosity. And we all know that ischial tuberosity is where the attachments are that cause so many of the problems. They cause the pressure to be imbalanced in the hip. And just with the palm of your hand, work down the IT band, loosen up some of the muscles, bring it back out again, rock it back and forth, and again pull, twist, raise, and then again go through this fulcrum. And you can do this several times. You'll be surprised how good you can relax the structure of this innominate, one half the hip at a time. And we'll come out of that. And normally we do that on both sides. And from there, we're going to go up toward the upper part of the thoracic. Basically, we've done a nice relaxation all the way down. And in the upper part of the thoracic, we want to go into a scapula traction. And I have the luxury of having an electric table. So again, some of this comes from the zero balancing, not quite the same, but a variation of it. I'm going to reach down and I'm going to capture the tips of the scapula, get up underneath them, and then bring them up toward me and just hold, and use this mild fascia traction and allow the fascia just to relax and slowly raise. So I'll take my palms and I'm going to come in face down and roll my hands up. If I can't reach the tips of the scapula comfortably, I ask them, simply place your hands palm up for me, please. There you go. And what that does, allows the tips to come down toward my fingers. Now you can relax. Once I have the tips, I simply pull back and allow gravity and time to occur, and what you'll feel is a real nice lengthening. The scapula just kind of releases. This is where those attachments are down around the teres major. Sometimes a piece of latissimus dorsal actually attaches at this point on the scapula also. So you'll get a very nice release out of it. Then we want to come up toward the occipital region, and we want to use a muscle energy technique to release the first cervical vertebrae. Correct? Yeah. Richard Fay has a very good way of doing this. He has a course called Onsen, which is in pain management. And what this allows you to do is to release C1 the occiput. That happens to be one of the primary places where people have a migraine issue. When C1 clamps to the occiput, then you're compromising the blood flow of the vertebral artery and some of the nerves exiting the cranium. What this allows you to do is to release that C1 without doing a chiropractic manipulation. Normally, what I would have done also is I would have taken this neck through a range of motion. So I'll go ahead and do this first. And often I'll do this when I do the assisted breathing in the beginning. So I'll just go ahead and do it now. I'll take and I'll place the tips of my fingers underneath the occiput and very easily just allow it to stretch up underneath my hand, constantly controlling, making sure that he doesn't feel I'm going to let his neck go. Again, you don't want to place the neck in hyperextension. Make sure you keep it fairly straight. And this allows you to go through and test. And we'll go further into this particular movement later on in this video. But I just want to make sure and feel that he doesn't have any real discomfort. If you have any discomfort, Wayne, it's really important that you say that is uncomfortable. The pain scale we work with is 1 to 10. 1, you just feel it, and 10 is just too uncomfortable. And I prefer to work within a 3 or 4, and that means that's just uncomfortable. And then we'll figure a way to do that. So this feels pretty good to me. So at this point, I would say make sure that that C1 is released. To do that, I'm going to ask Wayne to raise his head up just like this. And as he does, relax your head for me. As he does, I'm going to resist it. So I'm going to place these fingers right underneath the mastoid process where T1 comes out up underneath it. And on this side, the same thing. What will happen is he's going to raise, I'm going to resist, and as I'm pressing into the transverse process, raise and release, and raise and release, and raise and release. I'll put a little bit of effort into it. Again, raise, release, raise, release. And often you'll hear a click, and that click is the shift of C1. So using the transverse processes by locking them down, and as he raises in, we put a slight pressure into it, muscle energy technique, and it causes that vertebrae to shift. Okay? And we want to go into what's called a vault hold. Vault hold is a hold that I picked up from Michael Shea in his cranial regiment. Again, I do it the way I like doing it. I believe he just uses one finger right across the ear and runs the fingers down along the base of the occipital ridge. I like using 2 fingers, so I bring one finger right up to the temporal region, one down to the TMJ, and the other fingers kind of go down and wrap around the base of the occiput. The key is to pull slightly towards you and raise the head ever so slightly because you're doing a dural tube extension. Now this takes a lot of effort on your hands. At the same time, you're going to visualize going down through all of the vertebrae. So basically rocking the head, nodding motion for the atlas, and then axis. And just see yourself going C1, C2, C3. See if you can feel any restrictions and visualize that you're going down through all the vertebrae, all the way down to S2, because you're doing a dural tube extension, and remember that the dural tube attaches primarily at C2 and S2. I go all the way down in my mind visually, and then I come all the way back up, and it's not uncommon for people to go to sleep when you're doing this. It's very relaxing. And then you just release. The next thing we're going to do is a finishing technique for this, and that is this leg rocking. They make a machine called a chi machine that the Chinese developed. They say it was a wooden box, and you placed your feet on it and had a hand crank. And what it did, it moved you back and forth. Now you've probably seen these exercisers that do this. I actually have one here in the clinic. And the chiropractor's been using it for quite some time now because it gives you a nice spinal alignment. It loosens up the entire structure from head to toe. What I've done is figure a way to use the same concept and add a traction to it. Again, it's handy to have a table that you can move. If you don't have a table, you just have to figure out the right height. What I take is an old karate belt, and I put a bowline at each end to make a loop. And I place it on his feet and around my shoulders to such a point that it's comfortable. And if you do it right, I tell people it's like putting on a bad bra, like I should know, okay? And you simply pick it up and start this nice jostling effect. And watch the body, watch where you're shaking. You'll see it all the way up to the head. Now what's nice about this is this will really loosen up the hip. Now for some reason you want to loosen up around the neck, simply change the direction. As you bring the legs together, it's actually tractioning all the way up to the cervical vertebrae. Again, if you happen to have a QL problem that's a little tight on one side, what you can do is you can walk out to the side, and you can do that on both sides, and then just get into a nice easy rhythm. I usually do this for about 2 minutes, and it's really easy on me, just to lean back and like going skiing. The trick then is to release it suddenly, and when you release it, step away. And what he'll feel is this proprioceptive rush that occurs. Suddenly that jostling, all these proprioceptors are running straight up his spine. That's a very relaxing thing. And that's what this entire regimen is about. It's really relaxing the spine by balancing the spine. So this person isn't in a real serious amount of pain. We'll say they had some discomfort. But overall, this is just a very nice relaxing routine, and you can incorporate anywhere in with your routine. We're going to take a break at this point, and then we'll go on into the next section. Okay, this routine will be, as it's listed, torso balance routine. And again, it is just that. It's going to balance the entire torso, doing a lot of myofascial work. Some of this myofascial work comes from the Core Institute, and they do a lot of work that came off of Rolfing. The concept being to loosen the subcutaneous fascia, and in turn that allows you to loosen the deeper fascia. The nice thing about this type of fascial work is you don't have to hold it for those 3 to 5 minute holds that John Barnes holds. So George has found that if you do it effectively by loosening the subcutaneous fascia, that you'll get quite a bit of result. And it's a very good protocol to work with, so I thank him for his work. And again, we'll go from here. We're going to do the assisted breathing techniques. Again, I like the breathing techniques. They force the person to learn to breathe. It really gets the metabolism charged, and the pain goes down. So we'll do the same thing, a deep breath, and blow, and shake it out, deep breath, and blow, and a deep breath. And the same thing then, get over to the thoracic cage on the side at the costal arch, holding up here at the clavicle and sternum, deep breath and blow, and breathe, and blow, and really shake it out, and release. Okay, so you'll work out the breathing, you'll get the lungs expanded, that's a really important thing to do. And next thing we're going to do is start doing some of this spreading. And again, the Rolfing protocol is to work up the front and work down the back. And then kind of following the meridians at that point. Now the Japanese say to loosen the erectors from the bottom up. Does it matter? I don't know. I do both. And as long as it works, that's what I use. So I'm going to bolster his legs. And we're going to use some cocoa butter, not much of it. Put a little bit on our hands. St. John has a good course in visceral manipulation. You might consider looking at it. It's called Visceral Manipulation for Somatic Dysfunction. If you'll capture the Lena alba right in here, and then just press out, nice and slow, using your hand. I need to get a better position for myself here. And you'll work up one side around the ribs, and then come to the other side. You're going to work here. Again, I'm only going to do 1/2 of this. So working this, you want to work around the viscera. What I then do after this particular work is I'll go through doing a little visceral manipulation, starting here at sigmoid colon and work all the way up under the costal arch. I'll tell him to take a deep breath for me and blow, and as he does, I'll kind of shake my hand up underneath the arch, and again pulling down around the stomach here, down around the liver, massaging this, and again deep breath and blow, and work up underneath here to affect the gallbladder, and all the way down until you get to McBurney's point, and kind of work that ileocecal valve. And I work it in a clockwise rotation, and that's the visceral part that I add to this spreading. The other part then that I'm going to add is a little more rib work. I'm going to reach up underneath here and hold, and he's going to breathe, and I'm going to pull and relax, and as he does, I'm going to shake these low. There you go. And again, breathe and blow. As he does, I'm just pulling these ribs inward. So I want to get a lot of mobilization of the ribs, and I want to do a lot of fascial spreading. You want to work with what's called Langlier's lines. Dr. Langelier figured out that if he cut along these lines that there was very little scarring, and so it followed that the fascia really runs in these lines also. One of the best things I learned from the core work was that the fascia releases best if you work perpendicular to the muscle. So if your muscle is working, go across the muscle. Also follow Langlier's lines, and you'll get a much better release. In fact, the lines represent just about the dermatome pattern. If you look at both charts, you'll see that they look quite a bit alike. So you want to go through and just really loosen this fascia on both sides. Okay? And not a very complicated thing to do. Next thing that we want to do is some neck spreading. And I'll just raise the table up to where I'm comfortable. Again, having a table that's adjustable makes all the difference. You really have to work with your stances otherwise. But in neck spreading, there are several things to consider. The muscles that you're working with, you can think of fascia, or you can think of muscles. With a loose palm, that is a loose fist. I think George called this a velvet glove, and I just call it a loose fist. And it's a very similar movement. Just reach up to the base of the occiput and follow all the way down. And think of where your muscles are now. Here you have the SCMs. Right behind the SCMs, you're going to have the scalenes. A little bit further back, you're going to have the levator, and then you go into that semispinalis and capitis. So, if you want to isolate the levator, it's easy to find. Just hold on to the shoulder, asking to raise the shoulder up toward my hand. There you go, and release. And you'll feel when that muscle is working. But the biggest thing is stay posterior back here to the SCM, and just spread this whole tissue out. And don't forget to work deep around the base of the occiput. Also, some of the ear work is unique. You can pull on the ear and use it as a lever. And what I do at the same time is pulling on the ear and then spreading with the palm of my hand. So it's not as hard on the person by just pulling their ear, but it acts as a real good lever. It's usually very relaxing. And again, you don't want to slide on the tissue. You want a nice contact so that you're moving scalp. But pulling on that ear and going through all the directions of it are going to allow you to work the attachments in and around the SCM, temporalis, and again, work this entire area and go through it knowing that you're not sliding on anything, but loosen up that cranial cap, and that's a very powerful thing that you want to do. Now we'll get more into the neck work in that particular routine. This is just a real good loosening protocol. Okay. After you've done that loosening, then you can actually get into some good range of motion on the neck. And normally this is where I ask the person to slide back toward me until your head is off the table. Keep coming. There you go. And place your hands under your hips for me. I think Michael Young uses this particular technique, and I like it. And so you place your fingers, again, under the occiput, and I control it next to my body. They feel like their head is not falling off. Again, don't be afraid to lay a person's body next to yours so that you can get some good leverage. And I hold the shoulder down. And how we doing, Wayne? Doing okay? Great. And he'll feel stuff like I just felt, nice little popping. And the inner eminence of my hand constantly works around that mastoid process at the suboccipital. And then again, I swap, and he's very secure. And I use my entire body. And I can then ask him if I want to increase this a little bit. Take a deep breath for me and blow. And that felt good. And then again, take a deep breath for me and blow. So you can see you're stretching out the scalenes, suboccipitals. Now if you'll move in this direction a little bit, again, don't place the head in hyperextension, really get those SCMs. Keep this head solid in your hands at all times. As long as he keeps his arms pinned underneath him, you have a real solid surface. And you may want to choose to brace into you. And again, there's no real best way to do this. Just understand that you're trying to give a good solid range of motion to the entire head and neck area. Then I'm going to ask him to slide back down a little bit. There you go. And I like keeping people's legs bolstered because it makes them more comfortable. But at this point, I'm going to have to take the bolster out because we're going to do what's called the ABC of this pectoral problem. As you can see, a lot of people have a pectoral that is chronically forward rotated. It's chronically pulling the shoulders forward into rotation. And you would think, well, that's just that pec minor doing that. It's not just this pec minor. According to Sharon Weiselfield, the latissimus dorso has quite an effect on this, especially in stroke patients that she works with. So the way to release this with a strain counter strain, which is Lawrence Jones' work that we're using, and a lot of people have taken from his work, and now they call it positional release, orthobotomy. Doesn't matter, it all works on the same premise. That is, there's about a 90-second neurological period of time that if you place a muscle in its maximum position of ease, that is usually flexion, that it tends to reset that muscle by taking away the signal, and then you give a new signal, and that signal says go back to normal working length. The way to work with this pectoral is to find the clavicle, go to the sternum, draw a line straight out to the axilla, and press in, and they'll usually tell you where sore spot is, and it's going to be usually right over the pectoral minor. At that point, you simply pick the head up and you aim the nose right over the area until you get a diminishment of that effect, this being the tender point. And I'll tell you, that feels much better. It's really important that you tell them don't talk with your hands while I'm doing this. And then you hold this position. You can either monitor the position and you'll feel the pulsing occur often as it releases. And it will take anywhere up to 90 seconds, 2 to 3 minutes, depending on how spasmodic it is. So that's the first release. And you bring it back in down to neutral and you do the other side. Now some people do all three of one side. I simply bounce back and forth between the two. I like that balance. When I'll ask you if you'll slide all the way over then to where your hip is at the edge of the table. The next one we want to work with is releasing subscapularis. And the way to do that is simply hold the shoulder stable, let the arm fall until it hits bottom. Simply twist it in and inward and hold it there. And that's the positional release for that subscapularis. And you'll hold it there anywhere from 2 to 3 minutes. Then I usually let it rest. I'll either go to the other side or I'll continue on this side. Next one is latissimus dorso, and it's almost the same. You hold the shoulder, but you bring it down again to its maximum range, and this time you distract downwards with about 5 pounds of pressure. And as you see, I use my leg. And what will happen after about 1 minute, I will slowly release and his arm will go down further. And then I'll add the pressure again. And I'll do this up to about 3 minutes. And then slide back toward the middle for me. So this is called ABC for a reason. We use facilitated positional release, muscle energy techniques, and ranges of motion. The muscle energy technique that I'm going to use, and I'll do it on this side since it'll be easier for you to see me, will place my hand up underneath the scapula and use it as a rocker. And then what he's going to do is just shrug his shoulder just like this. And that's going to turn just pec minor on. It's going to totally isolate the pec minor. And then with a post-isometric facilitation, push and release and bring your shoulder just like this toward me. And again, right there, and release. So normally we'll hold it about 5 or 6 seconds. Push, and we hold that a few seconds. 5, 4, 3, 2, and release. And then rock it back over your hand. So what I'm doing is here, I'm just rocking that back over my hand. He turns it on, I turn it off. And that's muscle energy techniques as we're using them. Okay? The next thing then after we've done this is we've pretty much gotten this down. We want to do a range of motion. And these are some arm fulcrums, and these will be used in another session also. I interlock my arm to his. I reach up underneath the scapula at the medial border, and I just simply help traction as I pull forward. And I control the scapula the whole time that I'm doing this. And this allows me to feel all the attachments along the medial border of the scapula, of course those rhomboids, and then with one finger over here I can feel where the teres is attaching, and I can do a little cross fiber friction with my thumb. And we can also reach in here and hold down along this axilla area and pull into that latissimus dorso and that teres major. We get a really nice range of motion. Also taking the hand palm facing up, and there we're stretching that mid trap. Okay, so that's a real nice. And again, looking at it from this side, I interlock, reach in here, and create a lever. Don't just pull the arm. I create a nice even lever the whole time, and he'll feel there's all kinds of good things going on here. Feel the angles that you want to use. Anywhere you feel restriction, then simply add a little stretch. And again, you can do the pin and stretch here, that is hold it and pull back, and hold it and pull back. And you can also do that partial spreading at the same time. So there are a lot of things that you can do in this ABC regimen to get this entire shoulder girdle to go down for you. And it's a very good release. The next thing we want to do is a torso twist. Now, in the first video you saw several types of torso twists. There's some optional belting. You can put a seat belt on a person. We're not going to do that. But there are several ways to do this. You can, of course, cross the legs, put them to this side, bring them here, and just hold down on the ACEs. Take a nice deep breath and blow, and rotate. And they'll have a tendency of sliding on you if you don't belt them like this. Okay? So some other options, this is one that I haven't used in a long while, is to place a figure 4 on this leg. Okay? And again, deep breath and blow. Blow. So as you can see, I can lock the leg down and they won't slide so much. So there are so many of these ways of doing this. That happens to be one. If it's too uncomfortable on the person, you don't want to do it. It's just that simple. It may be something that you just want to sit here and just pull, reach across, and just allow their body weight to work and have them pull back into your hand and release. And that may be all the twists that you want to accomplish. Again, this is a torso regimen to kind of loosen up the entire torso. You're going to do more when you lay this person face down. So at this point, I'm going to put him into a sideline position, and to make it comfortable for him, I'm going to ask him to lay on his left side. I'm going to bring this table down. In a sideline position, again, we want to go through this breathing regimen. I can't stress to you enough, use the breathing regimen anytime you can. You get a lot of mileage out of this. Deep breathing massages the organs. It increases your metabolism. It reduces your overall pain. It loosens up the body. Now, one thing I do that some people don't feel comfortable with, but it's up to you how you feel about this. I like throwing my leg across here. And I place it right here, right across the abdominal, and it keeps him from rolling. At this point, I'll simply take a deep breath and blow. And again, as you can see, here's another twist. And deep breath and blow. And I'm working these ribs. Then I'll reach in here again to that cost large, deep breath and roll. There you go. And a deep breath and blow. And I'm kind of mobilizing the ribs in my hands. That allows me to get deep under that gallbladder area, often where it gets restricted, and really gives me some good mileage on the viscera. That 12th rib tends to get really stuck. You can reach underneath and actually kind of pick it up. You're doing good myofascial spreading here. And the next thing, of course, that you do want to do is just that, a real good spreading. Ida Rolf always said, build sides. Take these pointy sides and flatten them out. Make something of them. So you can do it any number of ways. Using your hands like this. If the person has a tendency of leaning too much, simply place your arm right above them here, and that will keep them in a better proximity. You can take your arm and go from the midline and iron this out. You can iron down the back. Doesn't matter how you do this. You're a therapist. You know all these techniques of how to move tissue. And same thing here. But always make sure to work down around that crest. That crest is where a lot of adhesions occur. And so you really want to get a lot of mileage working along these Langolier lines. And that QL always tends to get stuck, and that latissimus dorsal gives us so many problems. So we do all this myofascial spreading, and we've worked the visceral, we've worked the ribs, really get some mileage out of mobilizing those ribs. And then we want to use some arm levers. And again, if you want to get a really good arm lever here for latissimus dorsal, pin it and stretch it. And pin it and stretch it. And as you can see, I use my arm, I just kind of wrap into it. And same thing here on that arm lever. I can hold his arm in this position, and now that's not near as comfortable, of course, as working on this side. And I'm trying to show you any variation that you want to use, doesn't matter. Problem is, you'll pull him towards you like this, so you have to kind of hold and roll him back, and hold and roll him back. And in the side position also, you can take this hip, grab it at the aces, do a real nice body twist, just like this, and kind of loosen it up. So there's any number of things you can do with this. The object is this: loosen the tissue, mobilize the ribs, increase the breathing. That's the really important thing to be doing. And from here, we'll take him into a prone position, that is face down. And this is where I get most of my mileage in this routine. I'm going to ask him to put his nose in this face rest for us. And we'll start out then with fascial spreading. And again, there's any number of ways that you can do this. The core people believe in going straight down. The Japanese believe in going up. Doesn't matter? I don't know. I do know this: the Langmuir lines run this way on the body. And that's really what you want to focus on, getting those lines, those Langmuir lines, to work for you. So, you can start out. And I'll just use just a little bit of this. He's a little dry in here. And again, the less lubricant you use, the better, of course, because you want really good spreading. You can start out with some nice spreading techniques, going straight down. And I'm using an open palm. And don't forget to go all the way down around the crest. Another technique I prefer to use is an arm technique. And I usually take and I weave around the neck and capture as much of this material as possible. So I'll take the back of my hand and I'll press into the neck and kind of work right here with it, and then with a soft hand allow it to slide, and I still have traction, and slowly I'm moving, now I'm picking it up from the shoulder, around the scapula, and then flat down. When I hit the crest, my elbow rotates again, and I'll drop it off on that side. And I'll do the same thing on this side. Again, I'll take the back of my hand and I simply pick up. Okay, so I'm going slightly under that trap, make a fist, rotate, slide around, really picking it up with my arm and ironing all the way down. I get to the bottom, and that's the kind of stroke I prefer to use. Okay, that's if I'm going down. The core work teaches you to spread off these Langmuir lines, and you can do that with fists, you can do it with arms. Doesn't matter what you use it, just understand that you're working out, and they have a tendency of wanting to work out and hooking. That comes from rolfing. You work out and you hook down. One of the techniques they use I like is to hold and then iron across. So you're holding the tissue and then ironing across. And all these are wonderful, wonderful ways of doing this. The neuromuscular people tend to be a little more dramatic. They want to reach in here with their thumb and just really strip through that laminar groove, and they're big into working the laminar groove. And they'll take a tool, often one of these tools, and sit here and work with this tool in the laminar groove, clearing it out with a little hand tool. And that's a wonderful way of doing that. I like using a covered hand, that is, and if you're not willing to cut your nails way down and really get these tools working for you, then you're always going to be limited in what you can do as a therapist. These are your tools. Make your tools efficient. People say, but I don't like my nails that short. Well then, get another job or learn something else. But to do it effectively, learn to use your hands. So, lock your fingers down, cover, give a real solid movement in here. And I'm working deep down in the lamina groove, but I can't possibly get as much as I can get if I lock my fingers in place like that. Now, chiropractic people use a thumb, and then they cover their thumb, and they do the same thing with a covered thumb. Really doesn't matter how you do it. I like using a covered finger technique like this. And again, working that lamina groove is really important. And again, you can think of the muscles you're working on. If you slide up in this direction, you'll suddenly hit the border of the trapezius. And some people grab that and try to break it like a twig. And that's a neuromuscular way of doing that. Doesn't matter how you do it. Understand the core work to this, as core myofascial says, is to loosen up this fascia. Get that subcutaneous fascia loose. Doesn't really matter how you go about it, so long as you really get it. Now, of course, they have their protocol, so it does matter to them how you go about it. But I take a little bit of everybody's work and put it to what works for me. The neck spreading, basically same thing. This is a good time to really work with the cranial cap. Get in here, get up underneath the occiput. Again, I take my fingers, just kind of cut deep underneath the occiput on both sides. I work around that mastoid process quite a bit. And now Tom Myers, which works with fascial trains, says he gets a lot of juice working out of this area, and he's correct, because there's a fascial band that goes from the bottom of the foot all the way up the back, kind of follows the bladder meridian, and goes across the head. Same thing, just good, solid scalp manipulation. Do not scoot, dig in, and then slowly make sure you're on top of the scalp and that the scalp is moving for you. It's always good to be able to grab the ear again. Grab that ear. Don't be afraid of grabbing it. Move it around and work with it. Don't work it separately. And if you'll do that, you get a lot of mileage in breaking adhesions that tend to stack around the occiput. Okay, that's a real nice way of doing that. The thing that I like to do the most is this next move, and it's the one I think I do more often than any of the rest of this. And this is a modified Sims position. Eric Dalton has a wonderful course on myoskeletal, and that is where I picked this from. He got the position from a doctor called Sims, named it after himself. And it's part of an assessment position to allow you to open some of the vertebrae. What I do with it is modified, of course, like everything. I think Eric goes back here and he works off of the back in this position. Me, I like doing it like this. The far leg comes in front. I always use a pillow in here to make it comfortable on the person I'm working with, because if they got real bony legs or something, you don't want them to slam their ankles together. And this is where I get real personal with my work, because I'm going to reach across and use my leg for a lever. And this allows me to rock the body using my legs. Sometimes I'll hook my foot right under the edge of the table. I'll capture this ACES. The table's almost low for me here. I'll capture the ACES, and according to Tom Myers, again, there are a lot of connective points around this ACES that you want to work to loosen up these bands of fascia that go across the body. So I always want to work those. And I'll take and I'll do that fascial spreading that core is talking about. Go across and hook. And what I often do is release a lot of rib restrictions and get quite a bit of mileage out of this. Now what I'm going to do for myself is hold this hand, place it back toward me, relax your arm for me, and as I come up, I'm going to move the arm, and that's going to allow me to spread across infraspinatus, teres, and really get some nice range of motion while it's being tractioned. And again, this is normally where I would have my table a little bit higher. That was almost low for me. Another thing I can do is just sit here and play John Barnes, and that is get in here and hold this fascia. If I want to go into those long fascial holds, I can hold them like this. I can clamp into them like this. Doesn't matter. I have a very strong myofascial hold. I can do just like this, holding down on the hip and with the arm, and let my body weight just sink in here and hold. This is a whole lot easier than simply doing the old-fashioned hold like this. Anytime you can use your arms as levers, just like this. You get very powerful movements through the back, these fascial sheaths, because your body can just lay into it, and you can spend the next 3 to 5 minutes doing this. This other position is very uncomfortable. So, that's the fascial spreading. And that's probably my favorite position to use. I get a lot of juice out of that, as Tom would say. So we've done almost everything except the last move, which I'm going to ask Wayne to sit at the end of the table for me. And this position, we're going to do another little range of motion. And again, all of this is designed to get this torso to lengthen, to loosen the restrictions. Remember that we walk in diagonals, and these internal external obliques tend to get stuck. We don't rotate very well, so it's a really important thing to get that rotation in the body. Rotation and spiral is the key to the body, because the body does naturally spiral. It's when it spirals too much that we often have problems. So I'm going to ask him to place this hand behind his head and this behind his back, and I'll tell him I'm a police tactics instructor. You have the right to remain silent. He's going to take a deep breath and blow and twist, blow, and just fall for me. There you go. And again, you're going to look toward your right again. Breathe, blow, and there you go. As you can see, I'm going to bring him way down here. Sometimes I'll just lay them just like this. And I can do that one more time. Deep breath and blow. And often I'll lay them just like that. Now, you have an option of using a seatbelt. Aromatis got me into the seatbelt, so I'm not going to take time to do the seatbelting at this point, but it is a very powerful movement. Now, some other people like doing some compression work while this person's bending. Corey uses it, Michael Young uses it, Aromatis, they all use the same technique. What they're primarily doing is asking this person to bend, and as he bends, you're going to go down and loosen the erectors all the way down. And again, remember that the Japanese Shu was the Japanese instructor that I had, and he has a big thing on Ama massage, but he always says loosen the erectors from the bottom up. So you know you can do that same thing as you slowly bend and blow. And so if you choose to do this, you can do that too. And again, and blow. So it doesn't really matter. Just understand that you need to control this person. If you want to control him a little bit better, place his hands across his low back. Just have him hold him now. Take a deep breath and drop, blow. So you can see I can actually control him a little bit better. I can use a lever like this if I want to work just up into this region, because I'm able to lever this back and open up this area under the scapula a little bit. And this pretty much concludes the torso balance routine. It's a good routine. As you can see, there are a lot of variables in here. Don't get stuck on you have to do it my way. Understand the principles. Loosen the torso. Get the breathing. Get the ribs moving. Get the viscera to relax through the autonomic reflex. And think about structure. At one point you can go deep into the laminar groove. Another point just stay on top of the muscles. Depends on depth and direction. What I say is work in 3D, and that is here. Work in depth, direction, and determination. What do you want to accomplish? And if you go to the depth and think about where you are, that's where you're working. Uplinger says intention's everything, and he's correct. So at this point we'll take another break, and we'll go on to the next regimen. Okay, what we want to do at this point is go to the next routine. This is a shoulder routine, developed specifically around a frozen shoulder problem. Frozen shoulder, if you don't know it, is when crepitus builds in the glenohumeral joint at this point, and it resists the movement of the shoulder. And when a person comes in, they won't be able to move their arm. The test, of course, is easy. Keep your shoulder down and see, can they come up here? No. Supraspinatus does first 15 degrees of movement, and it has to initiate this. And of course, it won't be working too well. Often it kind of gets very fibrotic where it attaches here. Remember that it slots up underneath the acromial and comes right here and attaches to the humerus. So knowing that, also know this can be a very painful procedure to have to work with people on, and you have to really work within their tolerance. Also, the orthopedic information says that tissue will try to rebuild itself in about 48 hours. So you have to convince this person to come in at least in 3-day intervals to stay on top of it. That's why PTs often have to work on it. Again, we're not licensed to work on a pain issue. What we're going to do is balance the structure by releasing the soft tissues. So we want to start out first with some of the same things that we've been doing. That is the assisted breathing techniques. Always go through the breathing techniques, especially for persons in pain, and that's going to help quite a bit. The fascial spreading, same thing. If you'll go ahead and go back through the fascial spreading, releasing the visceral dysfunction, a lot of the somatic pain will go away if you can quieten the viscera. And then again, do real good spreading all around the arms, going around the entire shoulder plex, and that's pretty important. And this isn't complicated, so I'm not going to go back through the same issue. Do understand that the clavicle is the keystone to the upper extremity, just like the sacrum is the keystone to the lower. You've got to get these clavicles to where they're loose, so you need to really clean all around underneath the clavicles. The acromioclavicular junction up here has a place that seems to stick, and NMT, you have to learn to really clear that out. Often they'll use a tool to clear some of the adhesions. You can or cannot choose to do that, but you'll get good results if you focus on the fact that you need to get this clavicle to mobilize. Okay, and I'll leave it with that. The next thing is facilitate positional releases. A frozen shoulder release is often this position right here, holding the joint and compressing. At this point, hold it 90 seconds, couple minutes, and by placing pressure into the glenohumeral joint, you will decompress the area and it will relax all the attachments. So that's your frozen shoulder release. The concept of this frozen shoulder routine I picked up from James Wisłowski, and I took it and added my own variations to it, and I thank James for having done the research and gotten me that far on it. The next thing we want to do, if possible, is called AK, arthrokinetics. A dancer, lady's name I can't think of at the moment, developed it. And it's basically a way of releasing joints. And what you want to do is you simply reach equal distance from the joint, capture it, and then not pulling but just plunging the joint together at a frequency. And they say use a different oscillating frequency so the joint can't resist you. And that basically is a nice way of loosening it. One of the concepts, I guess, is like loosening a stuffed drawer. If you push into it first, then it has a tendency of loosening. It tends not to resist as much as pushing onto it. You may want to support their leg, you may want to support their arm, reach down here and hold above the joint. It's kind of hard to do this one. And this will build your pectorals, believe it or not. Mine, that is. And there's a lot of energy involved in doing that motion. But that's arthrokinetics, and you can do it at any joint of the body. And sometimes you do the entire body that way, just starting from the feet going all the way up, hip, every joint, and do that. And that has a profound effect on loosening a lot of tension that's caught in and around the tissue of the joint. The thing that I want to really introduce you to is this two-position plunge. Again, this is the basic concept I took from James, and I've added my 2 bits to it. I found, first of all, building biceps because he was just plunging, and so I've learned some ways to do this. The key to the motion I found is to keep this shoulder from raising. You don't want the scapula involved. You want a nice solid lock. So what I'll do is I'll reach with my hand behind and hold the scapula, my thumb usually up around the traps. This allows me to do several things. I can also start clearing some of those trigger points and that tissue on the medial border. The key to it then is to push, twist, pull. Push, twist, pull. And stabilize, and stabilize. And you don't want to hold it tightly, so what I do is hold it with my arm in my armpit, and therefore I don't give him a terrible burn of skin down around the elbow, and I'm not just grabbing the elbow, I'm just kind of letting it slide. But you push it, twist it, plunge, plow, pull. So you're using the head of the humerus as a cleaning tool is what you're using. The second half of it is I can clean a lot of the attachments around the adjacent muscles. That is the supraspinatus. I can work doing some cross fiber in it. I can work around the trapezius, the levator. All this I can do with the opposite hand, a little bit of cross fiber work down around the attachments. Then when I switch to this position, I can do the same plunge and plow, but I can loosen up around the pex minor. I can loosen up around that deltoid. I can loosen the cochlea brachialis. Everything that attaches the cochlear process can be loosened up by doing some cross fiber work here. And even that subscapularis. So I get a lot of mileage out of one area. The key though is don't let the shoulder raise. Keep it real stable. I go from that position then, often I hold the shoulder down, and then I simply place it into my abdominal and I use this arm lever. And again, pushing into the socket, constantly pushing into the socket. This allows me to clean out that socket. Just like that. I'll then hold it, again, holding that shoulder down real solid. And I tell everybody this is preparatory work. That means at Christmas we get your bell and a good job. And so you'll feel all kinds of grinding and movement when you hold that shoulder down, and that's usually where the problem exists. So that's the key to this frozen shoulder in this position. The next thing that you want to do is use the arm levers once you've gotten some movement. Now don't expect to get a whole lot going with a frozen shoulder to start with. It'll take quite a bit of effort and several sessions to normally do it. Again, back to the arm levers that we had used earlier. Use those levers, pull into those attachments. Don't be afraid to reach down in and around the bony structures and really work the attachments. That's where you're going to get your mileage. Again, here's your pectoral, stretching it. Latissimus dorso. Back to stretching that pectoral attachment out. And that pinning and then stretching of the muscle is what's so good about it. You can pin it and stretch it and get a real nice movement out of it. Okay? Those are basically your arm levers, and we've covered those. The next thing is the muscle energy techniques. If you still haven't gotten enough release, say you want to work with this supraspinatus, we'll ask this person to push back toward me and then release and push back toward me and then pin it and release and stretch it. Pin and stretch again. Right where it attaches at the humerus, pin it and stretch it. And start breaking up that fibrosis that occurs right there. Okay? Next thing then, after we've gotten this shoulder pretty much balanced out, we need to re-educate the muscles back into a working order. And that's what PNF is, proprioceptive neuromuscular facilitation. I think Patrice Marcy has a very good course on that. And before I go further also, at the very beginning, before you do this, take the person through a full range of motion. Do active and passive range of motion tests. We're not going to cover that information in this video. It's something as a therapist you're supposed to know. If you don't know it, James Wisłowski has a good demonstration of it. Richard Fay has a good demonstration in his own course. Whitney Lowe has an extremely good orthopedic assessment course. I would recommend any therapist to take his information, because that's what's going to teach you how to do proper range of motion tests. And that's something that every therapist should know. So at some point we may make a video on something like that. But in the meantime, get one of these people. Benny Vaughn has a good one. I can't tell you how many more people have good assessment courses that you can learn how to assess passive and active range of motion for specific muscle testing. That's something that you should know as a therapist if you're going to do this kind of work. So, going on from there then, the PNF techniques. Now here's what that is. Basically the body works best in spirals, which means from here and from here. And what we want to do is re-educate these muscles back into proper firing order. To do that then, Wayne's going to push against my hand and push it all the way across, and then he's going to resist slightly, and I'm going to push it back. He's going to push it again and back again. And this works on one of those things called temporal summation. Every time you go over that area, more and more muscles are recruited to get into that particular motion. Okay, and again, and back again, and again. And the law of facilitation says that every time a nerve path goes through a certain path, it's easier to go through that the second time and the third time, each time, and push again. And so using temporal summation and law of facilitation to re-educate these muscles back into the proper firing order. And you do it with spirals, okay, by diagonals. Okay, so we've gone through that. Now we're going to lay him face down and do the second part of this throat and shoulder routine. And you'll just have to mix up this routine according to how it works for you. The first thing I'd like to do is to go back into it and do the fascial spreading. And again, go back and do the fascial spreading that we did in the torso routine, and that really works well. The next thing is trigger points. So people say, oh, I've got this terrible trigger point right here. Well, if so, place it in a position, something like this. Hold it. That's the position of release for that particular trigger point. Doesn't matter where it is, move until it doesn't hurt. That's the key to the position of release. You can pick up Lawrence Jones' work, strain, counter strain. D'Ambrosio and Roth has a positional release. Leon Scheitau has facilitated positional release. They all show you ways of using positional release techniques to take out what we call trigger points or tender points. You could bring the arm back to this position, hold that, and there won't be any pain to it. And again, take it out as painlessly as possible. That's really important. The more pain you induce into the body, the more guarding it's going to do. Going on from there, we want to go into what I call scapula shearing. Now this is my little thing that I've slightly developed. And there's a client I had, a bull tried to kill out in the pasture, and he walks in, his shoulders wrapped around his head, and you can't seem to loosen him up in any way. And this is one way I found of really getting the scapula to release. And there are many, many good ways to release the scapula. This just happens to be one that I use. And that is to treat these two surfaces, that is the subscapularis and the serratus anterior, as two magnetic plates. And instead of pulling them apart, which some people reach back here and reach into this medial board and try to pull it, I prefer to shear the muscles apart. And often they'll say I have a marble under my shoulder blade. Well, this helps reach that marble. The key to it is this: reach down and capture the clavicle between your fingers. Holding the clavicle between my fingers and then not grabbing but just sliding and kind of working under that clavicle. Then the tip of the scapula here and upon my hand, and create a rotation. So when I pull up, I create a rotation, and the rotation goes opposite to raising the shoulder. So it actually decompresses these rhomboids, that levator, everything that's kind of pulling up. And what I'll do is I'll do this several times on both sides until finally I'll feel this rolling of the subscapularis as it rolls across the ribs. It'll feel like you're running over marbles. And I'll do it from this position. Often I'll brace my leg so I can get more coverage here. And again, stay off that corporate process because it's very painful, but focus on lifting that clavicle and moving this scapula in a rotation. And if you'll do that a few times, don't wear it out, go to the other side. You have to go back and forth several times before it usually breaks loose. Otherwise, you'll just wear this person out. You'll cause way too much discomfort. I usually use some topical analgesic like Nature's Chemist on here because it can be very painful staying on this too long. So work it a little bit, go to the other side. Work it a little bit, go to the other side until you get both sides pretty much clear. And that's that scapula shearing technique. And it's a feel. You don't want to grab hard in the front. But you can do a lot of things while you're doing this. You can take this thumb and clear that attachment levator. You can work on a lot of attachments along the medial border of the scapula. You can take this thumb and work into that teres major. So you can do a lot of clearing of attachments at the same time. The next thing we want to go into then is the shoulder shovel. After you've gotten that, simply hold the shoulder. I think Dale Cosby is the one who introduced me to this. He was a wonderful therapist, very nice individual, and he's taught for Blue Cliff for some years. I think he's moved up north at this point. And so you press in and shovel into the socket. To shovel into the socket. What I may do is hold it on one side or the other, doesn't matter. The key is to press in and shovel. And I slightly help as I'm pushing it. And just relax it there and let it work. And this side works better for me. I can pull up on the shoulder. Okay? And so that's that shoulder shovel that we're doing here. The next one after that is a scapula attachment clearing. Now neuromuscular teaches you to place your fingers up underneath the trapezius until you get to the tip of the scapula, and then they'll take the scapula and press it up, and then friction around the tip of the scapula, getting all the attachments. Here you'll get some levator, some rhomboids, oh gosh, what other muscles are deep down in there? Some serratus anterior. But that's very painful to do this, so I prefer to do it like this. I'll take the arm and I'll place my fingers at the tip of the scapula, and I'll press down and roll the tip around my fingers. And that tends to be much less painful. That allows me to clear all of those attachments. And this is the superior tip of the scapula on the medial border. And as you see, I use my body. I just kind of press it into my stomach and I get more leverage, and as I raise it in here, my fingers go deep down around that tip. And it doesn't near cause the discomfort that some of the other techniques. And that's my big thing, is not causing as much discomfort. Also, one of the things is anytime you can, move the body around the finger instead of moving the finger through the body. That gives you a lot more to work with. From that, we've gone through clearing all the attachments, because when you're in here, you can start cross-fibering all the attachments, the infraspinatus, the teres minor, teres major, go a little deeper down to latissimus dorso, follow the latissimus down a little ways, go up in here and dig down into the supraspinatus, and fiber across that levator, and go through the rhomboids. One particular muscle that can be a real bear and cause a lot of trigger points is the serratus posterior superior. And you can only get it when you drop the arm forward. You can get the scapula forward out of the way, and it's right up here at the tip, just close to this levator. And you'll have to reach deep down in there to clear that one. But it causes some really nasty trigger points. Okay, the next move I like using is this arm lever, which is a pin and stretch. Now this is a very unique position. Sometimes I'll get a person to hold my elbow like this, and what I'll do is I'll capture the tissue starting right here at the levator, capture it, push in on the arm, and then pull out, holding down. And as I pull down, I let my hand slide, and this knife edge slides and it follows the levator all the way up and then hits the suboccipital. What everybody tells me is they get a tremendous stretch in suboccipitals doing this, but always pin it, pull, and stretch. And again, if you've got somebody that's got a real osteo problem, you don't do this. I've not had any problem with anyone I've done it with, because as long as they're holding on to you, they have some control, and you can feel if something's not right because of the resistance they're going to give you. And so this is my favorite little pin and stretch, and it clears that levator. Instead of just stretching the heck out of the head, use the arm as the lever and clamp the levator down. The last thing then that you want to do, that George, I think I always pronounce his name wrong, Kusleos, he's the head of the core myofascial group. He calls this driving the bus. What you want to do is raise up on the humerus, relax, capture the tip of the scapula in your fingers, tell him to take a deep breath and blow, and when he does, just raise the scapula up and kind of drive it back and forth, and this really stretches that scapula. It's a very nice movement when you can do it on a person that's easy to get a hold of. It's just another one of those nice techniques. Okay, we thank George for that piece of information. And that pretty much covers the frozen shoulder routine, and so at this point we'll take another break. Okay, this is the last part of the curriculum, and it's basically head and neck specific, and it's a routine for balancing the neck and the cervical region. Now, a lot of this is what we've already done, so I'm not going to go back through it. I will just kind of give you some direction as to how the routine works. Normally you start out, you go through your assisted breathing techniques, you loosen up the entire area from head to toe, do the arms, do the legs, get everything nice and loose. Again, that breathing is really important. You can't get the body to relax unless you get some air into it, and you can't get the pain to go down. The next thing is the fascial spreading, and again, go back through your fascial spreading and do the spreading all around the neck region. Get a real good workout on it. Loosen up especially this cranial cap. Don't get so stuck about, oh, this particular muscle here and that muscle there, but really just work the fascia. Again, all the muscles kind of congeal together through this fascial matrix, so really if you're working it, you're working them also. And again, that's not what neuromuscular people tell you, but that's what I'm saying that seems to work most. That's what I like of George's course in core myofascial, and I would recommend, if you really want to get good at structural integration, that they have a 10-step program that is advanced Rolfing. In fact, it's a softer Rolfing than most people know of. It's what was being developed by Ida Rolf and Bill Williams before Ida Rolf died, and that's what George is teaching now at the Core Institute. So the next thing to do is range of motion, and again, work with this range of motion. Take your time, get a real good, nice, slow traction into it, nice stretches. If there's any pain, for instance, he says it's painful on this side, then simply have him press against your hand, push against my hand, there you go. And this is your muscle energy technique, and then 7 seconds release and stretch it out. And if for some reason there's too much pain involved, such as down here where that semispinalis is, and he'll say it's real painful here, then place it into a position of release, something like this, until you don't feel any pain. And at that point, hold it for that 90 seconds to 2 minutes, after which you'll take it out, relax, test it, no pain, and then stretch out that area. And that's the positional release work that we're covering in the seminar. And again, most of the time, the direction for positional release in the cervical area is away from that side. It's kind of different than most of the rest where you go toward it. This will be away from the side that hurts. So if it hurts, it's usually back and away, something like this. That's the one thing that you have to remember that's a little bit different. The next thing is a face treatment. And so I'm going to use my chair to be comfortable. And Ida Roth made an interesting observation. She said you can't really get the cervicals to align good and release unless you do all of the face area, the muscles, internal and external. I don't really work in the mouth, but I do like working all around it. So we'll work the SCMs, come up there, and again friction through the scalenes, deep down toward that laminar groove. Again, neuromuscular will teach you to take your thumb and strip right along that laminar groove, and that's a good technique to use. Again, take the fingers and go into the base of the occiput and cross fiber there. I then take the palm of my hand and just really work that occipitalis, because that has a tendency of where people get stuck. I then work the cranial cap and the frontal and just get that entire cap working. And then you want to work down around the zygoma, zygomatic arch here, around the mouth, capturing here. This is some good TMJ work around the mandible, getting up underneath some of these hyoids, and work through the master, the buccinator, work this entire area. Just loosen up the entire facial area. Don't get stuck on what muscle you're on. Just loosen the tissue. Okay, nice cross fiber movements. And same thing here, work across the sutures. That coronal suture, go across it, the sagittal suture or sagittal suture, work across it. And that's a real good thing to loosen up. The thing that's unique about this that I'm going to show you something that works for me. Jeffrey Maitland has a really good curriculum on spinal manipulation without doing chiropractic. And one thing he says is place your hand underneath the transverse process of cervicals and feel the restrictions and kind of dial them in place by using the muscles. So what I do is something of a composite. I hold them in my hand, I'm working them here, at the same time I'm going to place my body against him. So I go into translation back and forth on the transverse processes. I go into extension and flexion and a slight bit of rotation and try to get this area to loosen. But here's one of the hardest things to work on, and that's that coles behind the trachea. So the coles and capitis, longus coles and capitis, are notorious about having trigger points in them, and they're always problematic with people that have severe neck injuries. You have to go in and treat those. The neuromuscular model I don't care for, and that is you push the trachea and everything aside, you reach in here, and then you cross fiber down into it. That's fairly uncomfortable. I've had people really resist that. But if I take one finger and slide it down and next to the trachea until I hit bottom, and then start moving the head around the finger, and I guess you would say this is what my 2 bits of claim to fame is that I found, and that is move the body around the finger instead of moving the finger around the body. And so here I can just follow all the way up, and I won't have any problem with a real discomfort. I've tested it on several people. Reach all the way down till you hit bottom, then I'll take my fingers up underneath. What I'm doing is holding, and then I take my index finger and I bridge up against the cervical vertebrae next to the area that I'm working, and guess what happens? Often you get vertebrae that just automatically move back into position that have been out of place for quite a while. And a person says, wow, something moved, and suddenly I don't have the pain I've had for so many years. And this allows you to do it. This allows you to really get deep down behind and work that coles and capitis in a way that's really not uncomfortable. Understand, I'm using my body and I'm using my hand. At the same time, I'm matching the pressure between these 2 points, and I'm just kind of dialing the vertebrae back in place by moving the muscle restrictions that are holding them. Okay, so that's a really good thing to do. The last move then is one of my old favorites. My partner introduced me into this 3-point hold, Chester Forrest. Wonderful partner. Everybody should have a good one if they're going to be in this business. You can't do better than have a good partner. And what I'm doing is holding the base of the occiput and the 2 gallbladder points with my ring and index finger. What else I've added to it is with my small finger and my thumb, I'm going to create a still point at the squamous portion of the occiput. So I'm doing several things at once. So I'm holding 3 points and then capturing the head with small and thumb and creating a still point. At the same time I'm tractioning back. Now I'm going to go above the clavicles and press down and hold into a myofascial hold for 3 to 5 minutes. And I can do this very comfortably. And this will give me a myofascial hold. Remember that the fascial sheet in the front comes all the way up and attaches to the SCMs. And this would be a really good release for that. At the same time, I'm inducing a still point. And some people tell me this hold comes from Reiki. I don't know. But regardless, it's a very relaxing sensation. It releases the suboccipitals and creates a very nice myofascial traction. And I'll hold this 3 to 5 minutes, and it's an extremely good finishing move. And then we release. And that's pretty much the regimen. So here's what we've done. We've shown you 4 different regimens. One to relax the spine, and you can mix any of these techniques that you want. One to work with the torso, one to work with frozen shoulder, and one to do some head specific work. I usually use part, if not all of these in a given regimen along with the lower extremity, and that's why you get a good amount of relief for the person. Understand it's not the technique I'm doing that's so important. It's the principle, and if you can apply the principles, such as anytime you can, move the body around the finger instead of cross-fibering, move the body and create the cross-fiber. Those proprioceptive signals come in to act as painkillers. It's much less uncomfortable. And that's really what it's about to me. Don't make it uncomfortable on a person any more than is necessary. The more comfortable they are, believe it or not, the easier it's going to be to work. Arnold Schultz's law says that very thing. The higher the stimulus that you apply, the less reaction you're going to get out of it. The lower the stimulus, the more reaction. That's why craniosacral says they work at 5 grams. I found it to be actually 5 grams past the fascial resistance. Everybody has their own way of doing it. Don't get stuck on any one. Use what works for you. This is what I'm offering you. And thank you for your time.